Welcome back to the Vitals Podcast. I'm your host, Chauncey, a little stuffy from a cold, but back again nonetheless to digest and bring you the latest in medical news today. It is Monday, September 16th, 2024, and I have some news for you to look over. As always, don't forget to follow the podcast. Feel free to check out my blog, link in the description, and share the episode with your friends to keep everyone you know in the loop. A man in Marrakech, Morocco, a nation in northwestern Africa, has been confirmed as Morocco's first case. While the case has been confirmed, minimal details have been released about the patient specifically, and the international public health emergency, as declared by WHO, is still in progress of being dealt with. In 2024, more than 20,000 cases and 500 deaths have been recorded across 14 African countries. The Democratic Republic of Congo is at the center of the outbreak with more than 5,000 cases this year. Vaccines, which are thought to be a vital measure in preventing the spread, have arrived in the Democratic Republic of Congo, but because of logistical challenges, it could be several weeks before they arrive in the most affected areas in the east of the country. Danish company Bavarian Nordic developed an MPOX vaccine in response to 2022's outbreak, which was approved in Europe and the United States by their respective regulatory organizations. But low to middle income countries, like the ones affected in Africa, use WHO's approval for vaccine use. Bavarian Nordic submitted their own MPOX vaccine candidate, Jynneos, for review in 2023. WHO has said that taking its time to review Jynneos and other vaccine candidates stems from the vaccines originating from smallpox vaccines, not MPOX, and WHO taking into consideration varying factors in low to middle income countries that may not be present in high income settings like the United States and European countries. On Friday, September 13th, however, it was approved. Over 245,000 shots have been donated by the United States, the European Union, and Bavarian Nordic to the Democratic Republic of Congo, the epicenter of this international emergency. UNICEF, Bavarian Nordic, and WHO are working to supply the 10 million doses estimated by Africa's CDC to appropriately respond to the outbreak, and the government says they plan to distribute the incoming vaccinations in early October. In 2022, the United States is one of many countries affected by a global outbreak of MPOX. Damage was eventually mitigated, and the Jynneos vaccination received by millions of Americans slowed transmission. The vaccination required 2 doses, and while the Clade 2B's outbreak in 2022 is long finished, Clade 1B of MPOX and its outbreak burns on in Africa and is the cause of our current global public health emergency. This begs the question, do Americans need boosters against MPOX? Dr. Ashish Jha, Dean of the Brown School of Public Health, served as the White House's COVID-19 response coordinator and assisted the administration on other public health concerns, including the MPOX outbreak in 2022. When asked if someone should get a booster because it's been 2 years and because we have a new clade, his suggestion is that he, quote, doesn't see an obvious reason for a booster, end quote. He continues, quote, my view is when we see Clade 1B arrive in the United States, if it starts spreading quickly, if you start seeing a lot of people who are previously vaccinated getting infected, then a booster campaign makes sense. I just don't think we have enough data right now to recommend boosters for everyone who got previously vaccinated, end quote. According to the CDC, the overall risk of MPOX to the United States remains low. Many public health experts emphasize that right now their focus is on making sure those at highest risk complete the initial vaccination series. CDC spokesperson David Daigle says that data collected during the previous outbreak, quote, shows that breakthrough infections after the 2-dose Jynneos vaccine series were rare, end quote. Dr. Justin Chan, Director of Infection Prevention and Control at NYC Health and Hospitals in Bellevue, says that, quote, vaccine recommendations are based on the level of risk from potential exposures, end quote. More than 2 vaccine doses are not recommended, quote, unless you are a lab worker who works with live MPOX and other related viruses in a research lab, end quote. And if you are a lab worker, hey, welcome to the podcast. We're glad to have you here. David C. Harvey, Executive Director of the National Coalition of STD Directors, sums it up like this. Quote, there still are some open research questions, including potentially in the future some need for boosters. But that's not the focus now. The focus now is on getting people vaccinated and getting them access to the vaccine. End quote. That's all for this week's episode, so thank you for tuning in. Follow the podcast and share this episode with your friends. Check out my blog, ChaunceyTaylor.com, link in the description. And until next time, keep your bottle strong and your spirits high. This is your host, Chauncey, signing off. Take care and stay healthy. I'll see you soon.